While the WHO declared a pandemic overnight, this doesn't really change our situation and certainly shouldn't be cause for concern. Really, we've been in a pandemic state for some time now, and really just as an indication of how widespread this virus is right now. It doesn't mean that it's increased in severity or should be any cause for alarm. And while it is more widespread in many countries now, we're still doing a really good job with our Queensland Health colleagues of containing this virus here in Queensland. We've still seen a very small number of cases only to date. And the other thing to reiterate is that the majority of people that do get this infection have a really mild illness. So around 80% of people really only have mild symptoms. So as part of our efforts to control the spread of this virus, MARTA have assembled a large team of experts and key people within the organisation who are meeting very regularly, often multiple times per day, and in close consultation with Queensland Health to ensure that we're taking all the necessary steps to play our part in controlling the spread of this infection. This has included the setting up of a fever clinic and working out ways to build our capacity should it be required to try and address this. If you're concerned you may have COVID-19, so potentially had a contact or travelled and have some compatible symptoms, it is very important to get tested. And Queensland Health, as well as the MARTA, have worked really hard to make sure that testing is easily accessible, whether it be via GPs, private collection centres or dedicated fever clinics. So I'd encourage people, if they're concerned they may have COVID-19, that they get appropriately assessed and tested in a timely manner. So we're receiving lots of questions about what to do about large crowds and gatherings. I think the main message here is it's important to follow the advice of the federal and state governments in this regard. It's seeming increasingly likely that some events might need to be closed down, cancelled or postponed, and we may also see school closures and other workplaces potentially, but it's important that we do that at the right time and when it's required that we follow that advice. The key safety measures required to control this virus are really the same things that we've been trying to tell people to do for years for all respiratory viral infections and in fact all infections. And that really is good hand hygiene, and it doesn't really matter whether you use alcohol or soap and water. The key really is just to do it as much and as often as you need to, as well as staying away from people that are unwell. And if you're unwell yourself, it's really important not to turn up to work. And if you're at risk of this virus, depending on the current situation, it's important to go and get seen, either by your GP or a specialised fever clinic, so that you can be assessed and get the right test.